Thank you, Dr. Carrico, and good afternoon, everyone. Um, we are going to be talking about the basics, back to basics with safe injection practices. Basically, just seeing what are some of the things that we need to keep in mind and that we need to make sure that we do to make sure that we provide our patients with safe injections and vaccines. So learning objectives today, we're going to review the basics of safe injection practices, look at some common administration errors outlined by the CDC, review preventative strategies in reducing vaccination administration errors. And as Dr. Carrico mentioned, look at some of the novel approaches for education and training that the Kentucky Infection Prevention Training Center and the CDC Project First Line has initiated. So measures taken to perform safe injection practices. That is what safe injection practices are. It does not expose the healthcare worker or the patient or any of the colleagues. It is part of standard precautions, which means that it should be done with every patient in every setting, every time. So standard precautions are not just sometimes. We always want to treat patients really like they have something that we don't want and we don't want to take home to our families. So that's always a good way to think about protecting yourself and your patient. And then injection safety then prevents the transmission of infectious diseases. So common vaccine administration errors outlined by the CDC is incorrect vaccine route, site, or dosage. I always want to make sure that we look at the age of our patients, the immunization schedule, and see what those recommendations are to make sure that we're doing that right, the wrong patient. Documentation errors, making sure that we document everything properly, give the patients the vaccine information that they are receiving, and then storage and handling of vaccinations and the preparation. These are very important because we do know that if we do not properly store or handle vaccines, we can then compromise the integrity of the vaccine, and then our patients do not get the protection provided by the vaccine. And then scheduling errors. This then allows, if we don't pay special attention to the scheduling, the patients can get unnecessary vaccines or not the appropriate protection. So we want to make sure that we don't give vaccines too early or too late. So try and adhere by those schedules. Here we have unsafe injection practices and what some of the areas are that include these unsafe practices. The first one, reuse. We never want to reuse needles or syringes. We want to use new needles, new syringes every time for every new patient. We want to make sure that we don't use a single dose vial multiple times. We don't want to use reused needles or syringes in saline bags over and over because you can contaminate those bags. With the unhygienic practices, we want to make sure that we always have clean surfaces where we are preparing our vaccines, that preparation is away from patient care areas. We want to make sure hand hygiene is performed, soap and water or alcohol-based hand rub, and just making sure that we use a strict aseptic technique and not touch areas of the vaccine, of the syringe or the needle, the no-touch zones, making sure we don't contaminate anything. And then incorrect technique. Some vaccines are administered intramuscular, subcutaneous, or intradermal. So we want to make sure that we know how to administer these properly because that's how they will be effective. So the angle of how you will administer the vaccine, whether it's 90 degrees, 45 degrees, needs to be reviewed. And then biohazard waste. We always want to make sure that we discard sharps properly and puncture and leak-proof sharps containers. You also want to look at your facility's waste management policy to make sure that you discard waste. The general rule is about 3/4, when the shop's container is about 3/4 full, make sure that it is then closed and sealed off. So here we have an actual outbreak that happened in 2008 in Nevada at an endoscopy center. And we're going to walk through what exactly happened. So a new needle in the first picture, you'll see a new needle, new syringe where medication was drawn up. This medication was then injected into a patient with hepatitis C. So what we know is when we administer vaccinations, a backflow of blood occurs, and this blood then enters the syringe part of the vaccination of this syringe. So in this particular case, the nurses were told to discard the needle that was used and keep the syringe to save costs. And so they used the same syringe and a new needle. But now that we know a backflow of blood occurs every time we give injection, we know that now hepatitis C particles are in that syringe, and those are marked by the X, if you see it in the picture. The nurses then go back into a multi-dose vial and draw up the next dose for another patient. So with doing that, some of the hepatitis C particles enter the multi-dose vial. And now every patient that gets any medication from this vial will practically be injected with hepatitis C. So this was an actual outbreak. And nurses just followed orders, did not ask any questions. And this is very important to educate our staff and so that they ask questions and not just take orders. They need to know the rationales behind things. They need to understand what happens. I don't know if many people realize that backflow of blood occurs, and perhaps if we could see germs or pathogens, we would make better decisions and improve our training that we provide to our healthcare workers. And that is something that we here at the Kentucky Infection Prevention Training Center and Project First Line, the CDC's training and education initiative, is looking at how do we train our healthcare workers in new and innovative ways, such as the use of simulation. Now, in these pictures, this is something that we created here in our training center, is to make germs visible. So we use fluorescent powder in these vials. And in that example that we just went through, this would be how germs would look inside a vial. And that would be how the second picture would be how the syringe would look containing the germs. Because remember, they kept the syringe with the backflow of the blood and a new needle. And the needle part is not illuminated because that is actually clean. So then if people see this, who would like a dose of this vaccine? Usually nobody. So this is a good way of training staff and making sure that those connections are met with visible examples. And also this is very impactful for an adult audience. So some of the outcomes challenges as we are talking about training and educating our healthcare personnel on safe injection practices is the application. So we know that we need to use the correct infection prevention techniques, and the only way to do this is through having the knowledge to do so. Transferability, making sure that we don't only study and learn everything in books, read PowerPoints, but also do some hands-on activities. And then hopefully we can then take whatever we learn in the classroom or in training and then apply it into the real world setting without much guidance or oversight. Knowing and understanding why. This is very important, the why and the how behind infection prevention and control practices, because then you can transfer it to any setting, anytime, without having to think, is this the way I'm supposed to do it or not? It will be then standard. and part of your practice. Recognizing breaches are important, and when you understand the concepts, the why and the how, you're easily able, so those nurses would be would easily recognize those breaches, knowing that if we just got rid of the needle, this syringe is still contaminated. And then responding to those breaches, if we recognize them, how do we fix them? How do we enable staff to do their best work? So those are important things to put in place. And then sustaining practice. We want to make sure that despite any turnovers or changes in the environment, that we still maintain that high standard of infection prevention and control in safe injection practices. Finally, we have a couple preventative strategies, always following strict aseptic technique, making sure we do not touch those no-touch zones of syringes, making sure that we don't contaminate them, and then making sure staff know what are these no-touch zones, preparing vaccinations in a clean, designated area, making sure it's disinfected, making sure there's no interruptions when injections or vaccinations are prepared, because some vaccinations really take is very involved with reconstituting and all of that. And we don't want errors to occur. And if errors do occur, we want the person preparing vaccines to make sure that they're able to catch these errors. So we want them not to be distracted by anything. So keep that away from patient care areas. Vaccinate healthcare workers. This is important because we don't want healthcare workers to become transmitters. We want to make sure that they are protected for their own good and also for the patients that they care for. Eliminating unnecessary or invalid injections. This goes hand in hand with sticking to the vaccination schedules, because if you give the vaccine too early, then it's not, it won't be as effective. And then that's an additional vaccination for your patient. And, you know, with adults and new vaccines on the horizons with multiple boosters, and you want them to come back. So you don't want them coming back for unnecessary doses. So making sure we do things the right way. Implementing methods to reduce exposure and preventing infection transmission. Review allergies. This is a big one. I know Dr. Carrico earlier mentioned if we have pre-filled syringes that contain latex, making sure your whole office and your staff know what this is in case you have a patient that has a latex allergy, everybody's aware. Contraindications, precautions, pregnant women. We want to ask these questions, make sure that we know that they are pregnant or immunocompromised patients, patients with splenectomies and stuff like that. So just making sure you really do a good documentation, back to the previous slide. And then finally, educate, train, and retrain. I really want to put emphasis on retrain because education needs to be ongoing. It's not a one-time thing. Our memories fade. We have nurses that have been nurses for 40, 50 years, and we have brand new nurses. And who knows more than the other one? That's a debatable, right? Does it the 50-year-old know more than the brand new nurse? That's not necessarily true. And the other way around is not true either. So we just need to make sure that we constantly train and retrain our staff, and then find these innovative ways, such as simulation, hands-on training, things that we can, that different learners can learn, make sure everybody, whether you're a verbal or visual learner, you can then get the information that you need. And with that, I have come to the end of my presentation.